Very good morning, judges. Good morning, everyone. I'm Dr. Aashna Patil from Mumbai, and I'll be presenting you the abstract study done by me and my colleagues in the city of Mumbai only across 21 centers in our own clinics. It was a cross-sectional study. We have taken around 591 newly diagnosed type 2 diabetic patients. The time since diagnosis was very recent, 3 months to 4.5 months. And as we all know that type 2 diabetes is often associated with various comorbidities. So understanding the relationship between these comorbidities and the onset of type 2 diabetes is very crucial for early intervention and management. So we are looking at them in the very beginning, not later on in the disease. And our aim was to investigate the prevalence of these comorbidities and their association with the onset of type 2 diabetes. So as I said, it was a cross-sectional study taking 591 newly diagnosed patients, and we collected the data. And then we have grouped them into 3 groups depending on the age. The first group was age less than 40 years, second group was the age between 41 to 50 years, and the third group was the age above 50 years. We have used the chi-square test and one-way ANOVA for statistical analysis. The results we got were very glaring and significant. So the mean age of the participants was around 46.5 years, with 54% of them being males. And as I said, they were very early in the diagnosis, so the time since diagnosis was 4.5 months. Now, we noted that the prevalence of comorbidities increased significantly with the age, and the most common comorbidity was seen was the hypertension, that is 28.8%, followed by hypothyroidism, that was seen in 7%, and cardiovascular diseases in 2.2%. And what was worth to note was the age above 50 years, where the prevalence of hypertension was very high, almost 50%. So almost 1 in 2 people were having blood pressure as well, as compared to the younger age groups. So our study reveals that such high prevalence of comorbidities, and particularly the hypertension in the elderly age group in the newly diagnosed type 2 patients exist. And this underscores the importance of comprehensive screening and management, especially again in the older patients, so that we can catch them early. Thank you.
Ma'am, did you
Yes,
look into gender-specific prevalence with these comorbidities like hypertension, hypothyroidism?
So since the gender ratio was almost equal, like males were hardly 54%, and so it was almost equivalent.
No, in hypothyroidism, in hypertension, I am asking.
No.
You didn't look into, because I was most interested. So how was the prevalence in different gender? So again, one of the study. So did you look into the similar studies recently? When did you conduct this study?
So this was done more than 6 months back.
6 months back.
Yeah.
And did you compare it with the national recent studies done in India? So what is the prevalence in those below 40 to 50 and above 50 years?
No, so we have just taken the patients coming in our clinic, so it was a cross-sectional study. We have just collected the data what we are seeing every day in our clinics.
So I'm more interested in what is the current prevalence that we are having with these comorbidities, with diabetes. So is it going up, static?
Okay.
So we are more interested in that.
So current prevalence also, I can say that along with diabetes, blood pressure is also coming up, and we are seeing more and more younger individuals also with blood pressure as well. So it correlates, the findings correlate with the real world also.
A few questions from my side.
Yes, sir.
What was the inclusion criteria and exclusion criteria for your study?
So any patient who was newly diagnosed, they had to be newly diagnosed, and time since diagnosis was supposed to be between 3 to 6 months, not more than that, and they were not supposed to be on any treatment, excluding type 1 and pregnant patients.
That means you're talking about drug name. So what
Yes,
was
sir.
your cutoff for inclusion?
So 18 years, above 18 years of age.
No, time since diagnosis.
Time since diagnosis was 3 months, sir. Cutoff was 3 months, because HbA1c is last 3 months average.
You're contradicting your own points. How do you define hypertension? You've written 50% were hypertensive in above 50 years. So how do you define hypertension in a diabetic patient? What's the standard definition?
Increase in the blood pressure of systolic above 130 and diastolic above 80 millimeters of mercury at
Say again?
two different occasions.
Say again, the cutoffs?
Sorry?
The cutoffs for hypertension in a diabetes patient.
130 by 80 millimeters of mercury.
Any other definition?
Not that I'm aware of.
What's the ADA criteria for defining hypertension in a diabetic patient?
I'm not aware of that.
You have mentioned something regarding dyslipidemia.
The cardiovascular, yes, sir.
How did you get that in your study?
So we were just seeing the lipid profile of the patients. So the total cholesterol, LDL.
That is not cardiovascular disease. What are the targets for LDL in a diabetic patient?
So LDL should be less than 70 milligram per DL.
How do you define dyslipidemia?
So again, the definition I might not know, but then the values, according to the values, we know that
For any
LDL.
study, any prevalence study, any cross-sectional, for you have to define your definition right at the beginning.
Okay.
Then only you can write percentage. How did you define hypothyroidism in your study?
So we took the TSH less than 5 micrograms per DL.
That was normal. So how
Yeah.
many were subclinical? How many were frank hypothyroid?
We have not looked into that, so
How many were already on treatment?
yeah, that we have not looked into.
How did you define all those things? Somebody already
So basically
taking
they gave the
treatment.
history, they were having the history of thyroidism or their values were on the higher side and we have initiated the treatment.
You have not mentioned even the HbA1c. What was the presenting
So
HbA1c?
actually I have not mentioned it, but maximum of the patients had an HbA1c of 9 or above 9% right at the time of diagnosis when we saw them.
All those things needs to be mentioned in a tabular form whenever you are presenting a paper. There should be strict cutoff. There should be inclusion criteria, exclusion criteria.
Okay.
Do not mention anything in your paper.
Right, sir.
Yeah, I just wanted to ask the same question about the thyroid again. What was the inclusion criteria for thyroid? And Dr. Mayur has asked you the same thing.
Yes, ma'am.
And with respect to diabetes, what was the HbA1c cutoff? So the last two questions were on my mind
Yes,
too.
yes.
So
ma'am.
for hypothyroid, you have not looked into subclinical hypothyroidism. So you just went based on the TSH values, is it?
Yeah, the TSH value and the treatment history.
Treatment.
So, yeah.
But that is not enough for a paper presentation. You have to look
Okay.
into depth. And as he rightly said, you have not mentioned the HbA1c inclusion criteria as well.
I have not put into this, but we have the data.
Nothing
that,
in specific with respect to the gender specificity?
No,
Whether it
ma'am.
is hypertension or hypothyroid, have you noted any gender specific association in that?
No, ma'am. In our study, we have not done that. Thank you. Thank you so
Thank you.
much.